Hi, dear friends. This is Dr. Simanchal Goel, and let's see an interesting case where things can just take a turn around and surprise you, per se. As far as the consumables are concerned, used in the Phaco machine. So, I have started chopping this nucleus. These are some superficial chops that I was able to but I was not able to grab the endonucleus. But nevertheless, we are starting with the chop. The starting first half of the video has been sped up, and so that we will be getting to the crux of the video and how to tackle these challenging situations. It's been 16 or 17,000 cases for me at this time, and I have never seen such an occurrence in my entire career. As you all know, what how IULs are produced. IULs are made of acrylic, and acrylic undergoes a lathing process in the IUL industry, where it is polished, where it is made according to the specific dioptric powers. If you don't know what lathing is, you better check out some videos. Lathing is a very common industrial process used to polish optical surfaces, whether it's your 20 diopters, indirect IUL, or the glass industry, or the spectacle industry, or the IUL industry. The difference is you just spin the IUL around and take a sharp object and give it the contour and the curvature needed to reflect the light and refract the light in particular directions and dimensions. So this is the background I need you to just remember for this video, because in this video we'll be looking at the acrylic IULs and the differences and the lathing process that causes some unwanted things to come around. So I have just emptied the bag, done a successful Phaco. I'm just going on with the irrigation and aspiration part, not knowing what is in front of me ahead. I was taken aback. Seriously, I was taken aback, and I scolded my OT assistant. At this point of time, my OT assistant is loading the IUL and he will give it to me. I have just made the speed normal, and at this point, yes. So just by looking at it, can you guess what is this? Can you just guess what is this? With quivering hands, at this point, I had my hands quivering and shivering, and I was just looking at this piece of this gooey plasticky material that is sticking on the surface of the IUL. My hypothesis, I was just speculating and concluding these hypotheses and theories in my mind, that what is this? What material is this, and how can I get rid of this material, because it encroaches on the central optical part of the IUL. And even with the miotic pupil, the patient is going to have distortion and photopsias and all sorts of optical complaints in the postoperative period if I happen to just leave it like that. As you can see, the leading haptic is also stuck up with this material. The anterior part of the IUL is stuck up with this material. They are all glued together. In such case, when you have implanted the IUL in the bag, the IUL is right now in the bag and I have no way to go. Either right now I have two ways that I can get rid of this situation. First is I perform an IUL exchange, which I did not consider it useful in this situation. First, I wanted to take access of the situation, and then maybe I can get rid of this material itself. The IUL seems normal in other parts, except this part where it is just sticking with the IUL surface on the 3 o'clock position, and at the 11 o'clock with the haptic of the IUL. So I have asked my OT assistant at this point to give me a micro scissors so that I can release one haptic first. Releasing the haptic first and catching hold of the stability of the IUL in the bag is very important at this point, and These forceps are not so sharp, but yes, they will help me eventually. I am giving it multiple cuts so that the leading haptic releases itself. So as soon as one haptic is released, I just nudge it under the bag. Now the IUL is properly implanted in the bag. I am just left with this sticky, plasticky, polyethylene like material in the 3 o'clock position. And what to do now? If you would have been at my place, if you would have been at my in my shoes, what would you have done? Kindly leave your comments in the comment section below. If you feel you could have done better, or there was some other way that I could have evaded this situation. Yes, I scolded my OT assistant for not noticing. We as Indian surgeons perform high volumes of surgeries, around 20 cases, 21, 22 cases per day, and sometimes in distractions, OT assistants can mess up these things. He did not notice it while loading the IUL, and as soon as I implanted, I noticed this. So I'm just trying to pull this stuck plasticky piece off the IL surface, but I am not sure whether I'll be able to just hold the integrity of that bag, because it's not separating from the IL surface, and I cannot risk the zonular dehiscence happening in these cases. I cannot nudge the IUL here and there like that anymore. So I held my nerves and I thought of another way. Both of your hands, both of your instruments in your right and the left hand are an extensions of you. As a surgeon, they will become your body parts. They will become extensions of you, and right now I held this with my left hand, that is the micro forceps that I generally use to complete my rexes. And one last try, and then I asked my OT assistant to give me micro scissors in my right hand. And as these are my extensions, I just cut it off, and here you go. A sigh of relief. I was so happy at this point. And here is the part. So my theory, after I watched this video post-operatively, I I speculated that this must be a part of the molten acrylic that just stuck up with the IOL manufacturing process on the IOL surface, and my OT assistant unluckily did not notice it, and I implanted the IOL. I cannot mention you the manufacturer or the brand of the IOL because it will have medical legal ramifications, but nevertheless, the patient had a beautiful optical outcome. The patient was 6/6 in the post-operative time. It took me around 4 to 5 minutes extra. This was a topical surgery, and this was the part I feel that is molten acrylic that crept in during the lathing process. So things like these can catch you off guard, and you should hold your nerves and just go ahead. I mentioned this title because Stranger Things is one of the series that I like, and I guess you must have watched it as well. Ophthalmic surgery can take you aback and present you with stranger things like these, and you better watch out for these circumstances and just keep calm, have patience, and you'll be able to get rid of these things in no time. Kindly like, share, and subscribe my channel. I hope you like my stuff. And that's all from my side. This is Dr. Simanchal Goyal signing off. Next video, I'll be posting a very good video on Phaco ergonomics, because young junior surgeons generally struggle in these initial days as far as surgeon ergonomics are concerned. Your sitting posture, your IPD, and the settings of the Phaco. Thank you.